Hello, Dr. Joe here. So in here, I've got ashwagandha supplements. Why did I stop using ashwagandha supplements? I am going to be sharing my story on why I stopped using ashwagandha supplements, and it is not a pretty one. Now, because of what happened to me, I decided to explore what other users of ashwagandha were saying regarding the side effects of ashwagandha. You're going to find out all of that in this very video. If you are someone who's got a thyroid problem, well, there is something in here for you. If you are a diabetic, there is something in here for you regarding the effect of ashwagandha on diabetic medication. If you are a young lady looking to make a baby, well, there is something in here for you. And also, if you're a young lady who is on birth control pills, contraceptive pills, well, there is something in here for you too. If you're a postmenopausal woman, there is something in here for you. In fact, this video is for everybody. Now, what country has taken the extra step to ban ashwagandha? You are going to find out in this very video and why they did it. All of that is coming up. And of course, my story. But before I tell you my story, let's hear what others are saying regarding ashwagandha. We're going to be looking at the not so nice ashwagandha user feedback, and it's not a pretty sight. You got to pay attention to this because you may pick up one or two things for you to be careful about. Okay, so we're gonna kick off with this comment left here by V Baby, and she said ashwagandha makes you feel depressed, at least for her anyway. It did. Immediately within the first couple of days of starting to use it, she began to feel weird and then extremely sad for absolutely no reason. Okay, for absolutely no reason, she was feeling sad. So that was the comment that was left by V Baby, and other people chimed in because they had similar experience. Here's one from Asmat Javid, and she said he felt the same, not depressed, but he felt emotionally numb. Okay, emotionally numb. That's how Asmat Javid felt, and for him, he only took half a teaspoon for 3 days only. Okay, 3 days only. And after a few months, I tried again, and then the same thing happened all over. So essentially, what Asmat Javid did here was that he was suspecting that the ashwagandha was the reason he was feeling really emotionally numb. And but because he wasn't sure, he decided that he was going to stop it to see what happens, and then restart it again to see whether the same problem happened all over. And that was exactly what happened. He started using it, and then the same thing happened all over again. So, point proven. He didn't need any more experiments to confirm what was going on. So that was him. What about Jake Cole? He said yes, he felt the same as well. He had the same experience. It gave him mild anhedonia, so he was awake, not anxious, but not really caring about anything. Okay, not really caring about anything. I understand it's a stress reducer, but you need some stress slash cortisol to tell you to get the heck out of bed. So that is the comment that was left by Jacob Curl because he had a problem with anhedonia. So you may be wondering what anhedonia is. Well, I had to get out the definition for you folks here so that it is clear to you what it actually means. Anhedonia means a psychological condition that is characterized by inability to experience pleasure in normally pleasurable acts. So it is an inability for you to experience pleasure in the things that you normally find pleasurable. So you just feeling numb, sad, and not really feeling anything. That is what anhedonia is. And I have to say, there are lots of people who felt this way using ashwagandha. Okay. What about France's image photography? She also chimed in to say, well, that she once read a lot about it, that ashwagandha causes sadness slash anxiety and dissociation in some people. Okay. So this is real, folks. This is real. Okay. So I don't want to depress you guys all the way. Let's talk about the other side effects because beyond the psychological side effects, there are other side effects that ashwagandha does present. So here is one by Kitho 1990, and he says ashwagandha gave him heart palpitations. So yes, there is definitely side effects according to him. So there are cardiac side effects. That is what Keto 1990 is pointing out there. Something for you guys to note. Okay. If you've got heart problems, you want to be careful with that. Okay. You want to be careful using ashwagandha. Let's move on. And here is one that might interest all diabetics. And this is a comment left by Yankees fan 79, and he says, "Yep, he had a bad experience with ashwagandha. His blood sugars dipped dangerously low each time he tried using it." So essentially, what he's saying here is that it didn't happen on one occasion. It happened over and over and over again. Every time he used ashwagandha, his blood sugars dropped dangerously low. So if you're diabetic, you want to take note of that. Let's move on to what Sweet Mama P is saying here. And this is one that you guys have to really take into consideration. If you're someone who's got, thyroid problems, you really want to take note of this one. Because Sweet Mama P is saying that ashwagandha does interact with thyroid medications. It happened to her, and her pharmacist confirmed this very occurrence. So, if you're using thyroid medication, levothyroxine is medication that is commonly prescribed as hormone replacement for people who've got underactive thyroid, okay, hypothyroidism. If you're using levothyroxine or any other brand name of levothyroxine, you want to take note of this. So let's move on to September, who left this message regarding the side effects of ashwagandha. And according to him, it causes headaches for him. Plus, it does interact with certain medications and exacerbates certain medical conditions. And he added, it is not necessarily safe for everyone, but I'm glad it works for you. So he was replying to somebody who said, he had joy using it. So that's fine. You say, he's saying that, well, it does work for some people, but there are other people for whom they experience, certain side effects. And in his case, he had problems with headaches. So there we go. What about Yakabu? Now we're changing gears now, guys. We're changing gears because young ladies need to take note of this very complication of ashwagandha use. And here's what Yakabu is saying. And she said that do not use if you are on birth control pills unless you want an unpleasant surprise. Okay, and she wrote it in all caps for people to note. Okay, and that is so real because Kylie Gagalas replied to say, "You're so real for this. We love you." And Lilu Wang added, and definitely not during pregnancy. You shouldn't be using it if you are pregnant. That is common sense, really. But this is very, very important because it's been shown that, or it is suspected anyway, experimentally, that ashwagandha does reduce the effectiveness of birth control pills. In fact, the next comment lends credence to this, and this was a comment left by Superb Wami, and she says, "You're right. Ashwagandha may have an impact on hormonal contraceptives such as birth control pills or patches. Studies have suggested that ashwagandha may increase the metabolism of estrogen in the liver, potentially reducing the effectiveness of hormone birth control methods." Okay, so what this is saying is that ashwagandha does rev up the metabolism of estrogens in the liver, and obviously, when that happens, you're not going to get the right, blood levels that are required to provide you with effective contraception. So the next effect of that is that the birth control pill will become less effective. And what happens with that? Well, you're going to get pregnant when you least expect it to. So yeah, it's something for you guys to take into consideration. If you're a young lady, who is on birth control pills, it's probably best you stay away from ashwagandha. Okay. Now let's move on to the next thing. Actually, this is related to the birth control pill. Random creative person left this very note here to say this is good to know because it probably also affects HRT. HRT refers to hormone replacement therapy. Because in hormone replacement therapy, you've got estrogens, and in women who have their uteruses still intact,
then obviously you have to add progesterone. So essentially, if the ashwagandha breaks down the estrogen very quickly in the liver and probably the progesterone too, then it's going to render the hormone replacement therapy less effective. And this is a problem that I see often in the gynae clinic. Ladies who are on hormone replacement therapy, they tend to present with unscheduled bleeding. And now I've taken this with me now. And one of the questions I now ask is, are you using ashwagandha? If they are, I ask them to stop it. So, this is very, very important. If you're using HRT, hormone replacement therapy, or birth control pills, please take note if you're using ashwagandha. Okay, we'll move on. Lilu Wang also added this to say that they say it might cause miscarriage, but it's not proven. It's good to be on the safe side. I think you should consult an Ayurvedic expert if you're using it. So this is really important. As a young lady, if you are considering a pregnancy, it would make sense that you stop using ashwagandha, because if you do continue using it, there's a very good chance, you could end up with a miscarriage. It's not proven yet, but I've seen this all over the internet. People talking about the suspicion of ashwagandha causing miscarriages. So please, if you're a young lady and you're considering pregnancy, then obviously it will make sense you stop using ashwagandha at least about 2 to 3 months before you embark on your pregnancy journey. Makes sense, okay? So some countries have taken the drastic step of really banning ashwagandha. And Frederick Akamak here says here, in April 2023, Denmark as a country banned ashwagandha, stating that it is impossible to find a safe dose given the current data. The ban was based on a finding in 2020 by the Danish Technical University that ashwagandha has a possibly harmful effect on thyroid and sex hormones, and shockingly, that the herb may induce abortions. A close examination of the report reveals no presentation of any new data, but only a summary of past scientific experiments. So, Denmark as a country is not taking any chances, because as far as they're concerned, there are no scientific publications to tell the country or the government authorities there what the safe, effective dose should be. And for that reason, given the fact that it's causing so many side effects, then they just taking the next step to say, well, we're just going to ban people from using it. So
okay, now my story. But before then, a quick plug. This is my book on managing high blood pressure with lifestyle approach. Links to get the book right below this very video. So, what's my story with ashwagandha? Why did I stop using it? So, like I said, I wanted to use ashwagandha for me to share my experience with you folks. I was hoping that it would be a glowing recommendation, but well, it wasn't, because a month after I started using it, I wasn't feeling right, and I wasn't quite sure what was going on. And around the same time, I also wanted to change my car, because I had had my car for a good number of years, and I thought, well, let me get a new car for myself. So I went and bought myself, I bought myself a new car. And normally when you buy a new car, you should be happy, okay? Because it is an event after all, it is an indulgence, and you should enjoy an indulgence. But I didn't. I was just emotionally flat. I didn't like the purchase. I didn't like the whole experience. Nothing to do with the experience in the showroom where I bought the car. But even when the car got home, I just didn't like the whole experience. I never enjoyed the purchase of the car. And I sort of felt that this is not me, okay? This is not me. So anyway, what I did then was I stopped using the ashwagandha. And guess what happened? A couple of days later, about a week later, I bounced back, okay? The old Dr. Joe was back, and I really felt good. And as far as I was concerned, the ashwagandha was responsible for why I was feeling a bit low. So, being emotionally numb, like one of the guys talked about in the earlier part of the presentation, is real. I was just emotionally flat, and I didn't like that. And that was the reason why I decided that I would stop using ashwagandha. So, the emotional flatness is real, it's tangible, and it's not something that is pleasant at all. So, it's called, another name for it is anhedonia, when you don't enjoy the things that you normally enjoy. That's not good. That is not the life you want to live just because you want to use some supplement that's been recommended by some influencer. So regardless of what the manufacturer says, what the retailer tells you, or the influencer says, you should be observing what is happening to you and make the right decisions for yourself, okay? Because you are you, and you will know whether you're having a good experience with that very supplement or not, okay? So anyway, that's my story with ashwagandha, and I will appreciate it if you guys could share your own stories with me, whether it's positive or negative, right down below this very video. Now, if you're having joy with it, that's fine. By the way, I'm not saying that you should not use ashwagandha, because some people do have some nice experience with it, and that's okay, all right? But there are two sides to every story, and this is the other side of the story, and it's fine that you know about it, okay? Now, but I have a cautionary note for you here. If you're someone who is still having some joy from it, what I would advise is that you should not use it for more than 3 months at a stretch. Because how does it work? Well, ashwagandha actually works by suppressing cortisol hormone production, okay? It suppresses your cortisol. And we need some cortisol in our lives because cortisol is actually a life-saving hormone. You need it. We don't want very high levels, but we need some. And you don't want 0 levels. My advice would be do not use it for more than 3 months because you want to give your body time to recover, okay? And in fact, all the research that is on ashwagandha are usually just about 3 months or less. So we don't know what the medium to long-term effects are. So it makes sense for you to use it for just about 3 months. Give your body a break for about 2 to 3 months, and then you can go back to it again. Make sense? That would be my advice to you if you are having some benefits from using it. But obviously, if you're not, then it's probably best you stop using it. Anyway, I thought I'd share my story with you folks and the story of others. Do share your story with me down below. If you got some value from this very video, please go ahead and give the video a thumbs up. Please like the video, and also please share this video with your friends, family, and colleagues. If you got any questions, any comments, go ahead. Like I said, leave them down below. I think that's it for this very video. Until next time, well, this is Dr. Joe signing out.